Wow. Okay, so this session is being recorded. This is a bonus session for this week. We added this one in, and this is officially week 6 on authentic learning.
Mhm.
Our normal time, we don't have a normal time. So we met with Tom Reeves on Sunday and did a little session on authentic learning. And we've had 3 or 4 experienced people in a row. I didn't want to say retired people, but experienced people in a row. And so I thought it might be good to get some young blood in and get you excited about what's in the trenches. What's
Yeah, totally young blood.
What's that?
I'm totally young blood. I'm the late bloomer in this field.
Well, yeah, definitely you are doing exciting work. I read through your dossier, and Anita, you've really hit the ground running since your doctorate a few years ago. So I'm just delighted to see that happening. I'm delighted to walk through the dossier. So Anita Vyas has been in Houston for 10, 12, 15 years. How long has it been?
20, almost.
20 years.
20 next year.
Okay, wow.
So I just gave out my age in some way. So
since
young
she
blood.
was 4 years old, she's been in Houston. And Anita got her doctorate at the University of Houston, where I spent a lot of time. A couple former students in IST are in Houston. I spent part of the past week, much of the past week, creating a list of all IU IST alums who are working in faculty positions. And there are 2 people at Houston, Dr. Susie Gronseth, who's going to win an Outstanding Alumni Award or Early Career Award and get it next month, and Dr. Mimi Lee, who did 2 or 3 MOOCs with me. So
she was my mentor.
And your mentor. And we have another former student named Fong Fong, who's in humanities, working on creating instructional design content and other things. So there's several people in the Houston area, and more than that. There's an IU connection. Also, we have an IU connection to University of North Carolina, Charlotte, and East Carolina University, and Texas Tech, and Stanford, of all places, and Purdue, of course. So that tends to be where a lot of the doctoral students get placed. And Anita was lucky enough to find a couple. She's been at a couple of different places. Maybe we'll talk about her career, both while she was a grad student and where she worked, because she had some interesting experiences there, and then post the degree and what's going on there. And I've got 6 or 7 questions queued up, but I'll also make sure that the students that we have with us tonight, by the way, my class is about 22 students, I think, and they can watch the tape, the recording, or they can come to the live. They can choose which one they want. So there'll be people watching this later. So send questions later. Anita might put it in the chat window. Maybe you could do that a favor for us. And if we open up the chat, you could put the preferred email address in.
Preferred email, sure.
That would be great. So we all would have that. Now they've been sent the link to your dossier and probably have the email in there.
I'll put both of mine. So one is my personal, one is my work.
That will work.
Did it go through? Okay.
So BCM is Baylor College of Medicine, right? Okay.
That's right.
So Anita, can you tell us a bit about the work that you did prior to getting your degree? What were some of the places that you were at, and were you in instructional design positions throughout, or were there other positions that weren't exactly instructional design related?
Actually, I don't think I was in instructional design, like exactly instructional design. I think this field has sort of developed and evolved so much over the years. But when I started out, I was, like I said, I'm a late bloomer. So I did my bachelor's and master's in India, both in communication and urban ed. My actual dream was to be a fashion designer. And then there was one time when I wanted to be an artist. So I sort of flipped around before I got into communication and urban ed. I think I was always a technology geek. My dad was a computer consultant and my mom was a teacher. So somehow, that whole intermingling of education and technology was exposed to me really, really young. in my, in my early days, when I was in this field, it wasn't called instructional design. It was more like computer assisted learning. It was called educational technology, which it still is in some places, but more so it was called computer assisted instruction. My initial work was very much related to urban ed, in the sense that it was pretty much teaching at like those areas like slums and villages, and using communication aids to bridge that gap, that learning gap. So it was very much a lot of field work, very hands-on kind of work. Fast forward a few years, I moved around a lot as through my marriage, had kids. So I went to Indonesia, I came to the US. And in the midst of all that, I'm a techno geek. So I learned a lot of skills. I always like to learn. And I think one of the reasons why I'm in this field is that I get bored really easily. So I was the girl who always used to have a different hobby every month. And I think instructional design sort of allows me that, because you have to wear multiple caps. You have to know many different things. And since technology keeps evolving, education, and now even more so, after the pandemic, we are exposed to so many different ideas, different pedagogies, that, you're learning on the go all the time. So I think that's why I learned a lot of tools, Photoshop. I was a freelance graphic designer for some time. I did a lot of freelance work. But once I was in Houston and my kids were a little grown up, that's when I decided to go back to school. And this program just sort of came to me. It just sort of, I was browsing through universities, looking at, okay, I have communication background, I have education background, I'm a techno geek. Where do I put it all together? And that's how I saw this, doctoral program. But a lot of my instructional design work basically happened as part of the degree. Whatever I learned is, pretty much on the job and then much later. I think the good part of being in College of Education in U of H was I got a lot of different experiences with K through 12 education, higher ed, instructional design in those realms. I worked very closely with a graduate program for math and science teachers. It was an online graduate program, part of a grant for like 5-6 years. I was with them through conception. That's when I met Kurt for the first time, because he was a consultant.
I smart.
Yes. So I was their technology and sort of research facilitator. I also did a lot of the trainings for all the teachers, technology trainings, because the whole, the brief was for them that not only are they learning how to integrate math and science, but they're also learning how to use a variety of tools to engage their students in the classroom and to engage themselves, like their presentations, their assignments, that involved learning, having a sort of a toolbox of variety of instructional tools. So I've worked with them for a long time. I did a lot of side gigs at the time. I worked with the Children's Museum of Houston. I was a research lead for them in a project called 21 Tech, which involved using...
Let's stop on the museum, because I want to back up for a second.
Okay.
And I forgot a couple of things in the introduction. We heard from Kendom Guyback a few weeks ago, and Anita and Kendom are friends. So Kendom recommended we bring Anita in. I said, oh, that's a really great idea. So there's a connection here. If you're watching these videos later and you're looking for themes in your reflection papers, there's an theme. You might go back to Kendom's presentation or our discussion a couple of weeks back and compare it to this one, and you might see some overlapping things between the two of them. Bhutan is actually pretty close to India.
Yes.
Where Kendom is from. So there's that too.
She's doing the work that I did probably in the 90s. So it's similar.
Why do you say that?
Because I think, she's in that grassroots, she's working with those people. And that was like, passion of mine, as well, working
with disadvantaged and
yes.
people who lack access and all that. The other thing I want to point out is that you mentioned the word computer assisted instruction, and you mentioned ed tech as the name for this field. And when I got my degree, this is my minor, and they called it ed tech. And that was a common at Wisconsin and many places, especially internationally in Taiwan and in Korea, they would call it educational technology programs. And the past decade, they've been changing, and some call instructional technology or instructional design and technology, but many, the University of Houston, University of Hawaii, North Texas, Purdue, and many others are changing it to learning design and technology.
Yes, that's what my doctorate is in. Yes.
Yeah. And so that sounds a little more professional, I think. IST, the name is just a branded name, so we have a difficulty changing our name. But I've tried getting us to change to instructional technology, again, learning design and technology, because I'm a learning guy. Some Stanford puts it with learning, comma, design and technology, no second comma. Some have it as learning, comma, design, comma, and technology. Some have it as learning, design, technology, no comma. So Wayne State, for instance, where Anita too is at, who sat in a few of our sessions. She was my TA. So
that's right.
They've it's all varied, but it's the same kind of thing.
Exactly.
So it sounds like you were in this journey before you got to the U.S. And you've been in the U.S. coming on 20 years soon. So you've been in the field for enough time to do some reflection on the changes within the field.
That's true.
Yeah,
that's true. I think when I started the doctoral program, it was called educational technology. It was part of curriculum instruction. But then, over the years, it became learning design and technology. And I think, even when I was in India, and it was called a computer assisted instruction, because it was basically, using just computer related apps or computer related technology to teach, to communicate, to engage learning, to enhance, student outcomes. But I think over time, instructional, educational technology, I guess, it's sort of made it very limited, that, okay, it's just technology, where instructional design is not just about using technology, it's just about teaching good teaching at the end of the day. Now, whether that's online, whether that's face-to-face, it's basically, it's student, whether the main client is your student, whether they're getting engaged, whether they're learning it well, how the faculty are presenting. I think that's why it has become, they've sort of added more elements to this field besides just technology.
And that's good, because often this field has had people pulling elements out. For instance, the creation of informatics departments have pulled a piece of human-computer interaction out. Some psychology departments have pieces which used to be part of this. The learning science programs in particular have grabbed pieces of it. So people have been grabbing pieces, but no one's grabbed distance learning or distance education. That's it's kind of in part, but it's not. Even the learning design technology programs haven't really claimed distance ed as theirs. It's listed on your bio as among the areas that your expertise is in. But let's go back to the Children's Museum. Houston's known for having many museums in the museum district. Is the Children's Museum in that area?
Yes. Okay. It's in the same area.
Beautiful area. I just like staying in the hotels there. Tell us what you did in that setting.
Okay, so basically it all began, when I was still in graduate school. Some of us were approached by our program evaluation teacher, and she asked us if we were willing to take a lead on some research project, like a sort of an internship. And I was like, yeah, always the excited one. So they brought me in, and what we were supposed to do, and this was probably sometime in 2010. So they were writing a grant for NSF, or they were collaborating with a variety of different museums across the country to use mobile devices like iPads and, just your mobile device. And they had curated a lot of different apps that sort of were in conjunction with the museum exhibit. So say if it's a viscosity exhibit, they would have an app where, the kid would play with the viscosity exhibit, and then they had something, some kind of a game on the app. So sort of having that whole technology and, the interactive exhibit tie up. And that's what they were researching, is like whether it really enhances the learning, whether it really enhances the museum experience for all their, for the visitors. So that is, what I had done is I had recruited some researchers. We had created a questionnaire where we had floated around the museum and had, some of the museum personnel conduct those interactions with the visitors, and then we would just survey them. Fast forward a couple of years, I went back to work from them because they were looking for a project manager, and I was looking for a side gig to fund my rather lengthy doctorate program. I spent a year with them, and that's when I was responsible for all the communications, all the reports between the alliance of those different museums across the country. I did all the trainings, all the motivation trainings for all the museum personnel, because it's hard to always keep using those apps. And it was a very interesting experience, very interesting year. I learned a lot. I learned a lot of project management skills, a lot of people skills at the time, especially when you get pushback, or you have employees who are not motivated enough to perform or to deliver. Then what are some of the strategies you would use to sort of get them excited about using those apps, and conversing with all the visitors. And I would have contests, and we would have prizes and this and that, like who's the facilitator of the week, and which is the app of the week. And then we also wrote a blog called 21 Tech Blog, and every week we would have like app of the week, or we would have like some facilitation tips, and we sort of invited those facilitators to write those blogs with us as well, which was not done in the past, but it sort of really, enhanced the whole museum experience.
Well, let's pause on there then. You mentioned skills of project management being needed as an instructional designer. Is that continue to be a significant thing that you've needed as an senior instructional designer? And are there other skills that you've picked up along the way that you would advise my students in this class? This is an intro class within the field.
Okay. Yes.
So what kinds of skills would you recommend that are that you see highly valued, whether they're in the medical field or in informal learnings with museums or others? What would those be?
I think for me, I have the big three. I have three which are my most favorite ones. I think my first is quality matters. I recently took on the role of a quality matters coordinator at Baylor College of Medicine. So I oversee all the quality assurance of course design and all of that in the in the entire college, entire institution. So I think if given a chance, it's a really it's a really great organization to be a part of. Having that knowledge of quality matters and what quality course design and development and faculty development looks like, because a lot of institutions now, they don't require it, but they prefer if somebody has that kind of experience. That kind of role sort of came to me when I was working for College of Nursing, and we were that's when the whole that buzz came in that, okay, let's do some kind of a quality internal review of the courses and make them sort of high quality online. So I think that is one skill. You can start off by just, their subscription is free, their sign up is free. You can attend some free webinars, you can look at their newsletters, you can order some of their workbooks, but that is one skill that is really great. It will give you a very deep insight into instructional design and how quality assurance works in terms of instructional design. I think my second one is I'm not a trained project manager, but when you're in instructional design, the higher you go, there will be times where you will be, strategizing. You'll be working with multiple projects. You will be working with multiple stakeholders. So really scoping things out, developing a process, developing a model, speaking about a particular, say, like recently I've been working on developing a e-learning and training intake process, so if there is an institutional need, what is the process that one would go through, what would be the kickoff meeting, what would be that business phase, and then going forward, what would be the design and development phase, what are some of the key aspects that come into play, and then finally, when you deliver the project, and then you have quality assurance, and then you have a review, and then what kind of updates and what kind of follow-up. So, sort of, in instructional design, I don't think I ever learned any of these things in college. I think it was so theory based, it was so research based. Even my instructional design models were not that great when I got out of school. I think pretty much all of that I've learned, on the job, like even scoping out projects, developing trainings, like the whole process of giving out trainings, like how do people sign up, doing the need analysis, and finding what's the need. And so I think in instructional design project management, it comes very close. You don't have to be someone who was worked in a corporate project management position, but if you have like just basic knowledge where you understand what a process would look like, what a life cycle of a certain e-learning project or a certain training project would look like, then you're good. So those were my two main. Dr. Bonk, were you going to say something?
I was going to stop you after the first
Okay.
one because it's really
Yeah.
important. You said you got quality matters as in your job, part of your job. Do you do it in addition to everything else that you were doing?
Yes.
Or did they? So are you doing this at night and on the weekends, or how do you fit that into the job that you already had?
No, I don't know. Actually, it just came to me. So I just got certified last week, actually last Friday. I already had the basic quality matter certification, which I got in 2018. And that was, like I said, that was part of my College of Nursing job, because we were working with another institution where they were trying to, scale up all the courses and do like they were planning to launch a whole online nursing program. So that their requirement was that quality reviews and having the courses sort of look all consistent. That's when I got my certification and I got interested in it. That's why it's sort of one thing led to the, and once you have that certification, I brought that same experience into Baylor, where in the last year. Now, there's one thing that I would like to share about Baylor, about my job in the past year. Baylor did not have any instructional design presence before me and my previous supervisor came along. So they had nothing like quality matters, or they had nothing like course design and development and having consistent looking courses and having a consistent learning experience for students. There was nothing like that. When me and my boss, when we came along, we started the Education Innovation Core, and that's when we brought a whole QM-based template into play. And then, over time, we sort of launched it for one school. Baylor is a combination of 4 different colleges. So we launched it one by one for each of the colleges and converted all of the courses online. So I think one interest and certification, it just led to, they saw on my profile, I'm like, oh, okay, QM certified, there you go. So I think it was just like a happy accident. Now I think I have not yet started working on that role because I just got certified, but over time I think it won't be so much where I'll be reviewing every single course or doing professional reviews for them. It will be more like an internal review, where if somebody needs to get their course sort of quality assured, then they can come to me, and then we can have that conversation.
But did you pay for that, or did they pay for it?
They did. They did, yeah.
They did, okay.
Yeah.
So,
yeah, make sure the institution pays students.
Yeah. Is it expensive? Is it something that's expensive, or?
Not so much. Not so much. Yeah. QM courses, they range from about 300 to something, but they are intense. It is 2 or 3 weeks of your life where if you have a job and if you have a full-time job and a full-time life, like a mom or something, it's hard. It's really tough. They say that you need 10 hours in a week, but I disagree. You would really need to put in a good 15, 20, because they have a lot of reading. They have a lot of assignments or, discussions that you need to do. But then, once you are done with it, that knowledge is just set because it's so intense.
Who's in charge of that? Is it California University or someplace out there?
No, Maryland. QM was started by University of Maryland, but now they're independent.
Okay. And is it there's two QM courses, a beginning one, there's an advanced one, right?
Yes. There's a whole pathway as well. So it really, it really depends on your institution. And, I did the basic one, and then now I'm looking to do a more advanced one, as part of my role. But they're very helpful. So you can look at a pathway of where you want to go. If you want to be like a master reviewer, then you do 2 or 3 different kind of certifications. And I saw someone in the chat is already a peer reviewer. So yes, great going. You can, go for the 3rd one, which is the master reviewer or something. And then you can be a facilitator.
You want to jump in here, Kirsten, and say hi?
Can you hear me?
Yep.
Hello. Yeah, I've only done one peer review so far for another institution. Our institution, kind of like you, before I had taken on my role, we were not a QM institution, and we didn't have course templates or instructional design. And so we have, over the last 2 years, become a QM institution. I have actually asked $4 in my budget every year for faculty to go through it too, because I find that it's not only helpful for staff or administration to have an idea, but to really have faculty to go through. So that way, when we're implementing certain things and they're not understanding why, it helps them a little bit understand the why. But yeah, I have really enjoyed the certifications. I laughed a little when you mentioned the time, because that's something we always tell faculty. I am an overthinker, so I feel like it took me like 40 hours to do the certifications. But
I agree.
they were rough, but no, it's a great organization. And I'm hoping someday to do the master course, but I know you have to have so many reviews under your belt.
Yes,
so.
yes, you do.
So
You need to have 18 months of, I think, teaching
And I think
as
you
well
have
or
to do
something.
two. Yeah, I think you have to do 2 reviews,
Two
institutional
reviews,
reviews.
yes.
Yeah,
yes.
before you can do master.
Yeah.
Does Baylor have any QM courses, like certified QM courses? Not yet.
No. The thing is that the funny thing is, before I took on this role, QM was, they have been a QM institution since 2015, but it rested with the graduate program. So some of those faculty, just for their internal courses, some of them got certified, some of them, went through the QM process, and then they just sort of worked and reviewed their own courses, and they just, sort of improved internally. But it was not done at an institutional level. But now, ever since last year, since we launched that whole course, QM based course template institutionally, I feel that now, they're probably, I wouldn't say they're ready, but I think they're ready to have the conversation that, okay, this is an organization, your course is in a QM template. How about we sort of, get it reviewed?
Yeah, that's great. We don't have any yet for review, but we're working on that. So
yeah, same here.
Was yours paid for, Kirsten, or did you pay for it?
Yeah, so our university paid for it, and then I actually asked for it in our budget. I think this year I got enough for 70 faculty to go through it.
Wow.
To go through either the Applying the Quality Matters rubric or the PRC. So we have some faculty who went through the Applying the Qualities Matter rubric, and then we have some faculty. So we actually have subject matter experts, is what we call them, and they're required to go through the peer review course. Both, they're required to go through both. But we have dollars aside for other faculty who want to.
So pardon me for asking for the 59th time. Remind me where you're at.
That's okay. I'm at Trine University in Angola, Indiana.
Trine, it's Trine.
Yes, it's a private small college in the northern part of Indiana.
So it's good to see that confirmation that, this is important. It's growing. I know none of my former students have gotten certified, and it's helped them in their current job situations. So
yeah, it gives you a lot of perspective, I think. And I think it also, once you are at a more leadership level in an instructional design field, it really helps, build that, communication with the faculty that, okay, this is something that we can do.
Since you're on screen right now, Kirsten, did you want to pose a question? And anyone else can put in the chat window a question while I have more, but I'll pause for a second. Kirsten, you want to ask a big question or a little question?
Yeah, I did ask one. I asked if you had any institution, like had any courses reviewed through Quality Matters. But my other question is, we've used Quality Matters to design kind of like our own internal review process. Do you have something similar, an internal review process that you've developed?
Not yet. Yeah, because it wasn't, we have like right now QM was only limited to like a course template, so we have, and then whatever review we did internally as a team that, okay, this is some of the need, this is some of the feedback that we got from faculty, from students in the course evaluations, and, probably, improve upon some of those things, but nothing, there isn't an official internal review process. And I think, that's some of the things that I've been thinking about ever since I've taken on this role. I'd love to, talk about that internal review process if you could share or something like that.
Absolutely.
In the future. You can
absolutely
shoot me an email.
Yes, absolutely.
Okay, you want to continue? Oh, we got a question from Aaron in here. Okay. Aaron, you want to jump on and ask the question?
Oh my gosh. It makes me dizzy just to think how many courses. So let
Well,
me,
let's Aaron, Aaron, you got audio and video?
Yeah, I've got audio. My video is in my office, and
Okay.
for some reason, I just look like I'm in a cave. So I really need to get a ring light. But until then, I have audio. So
I'm in a
yeah,
forest, as you can see, and I had 7 trees chopped down behind me today, in the forest behind. So, it's a little less of a forest, but it's still a forest. Go ahead, Aaron. I'm sorry to interrupt you.
okay.
There he
Well,
is.
I was just going to ask about the modality of your courses. Like, I mean, are these traditional medical school courses that then have an online component to them, or are they hybrid?
yes. So most of the courses were face-to-face initially before COVID hit, because very typical of a medical college or any health care education institution, most of their courses involve a lot of face-to-face, a lot of lab, a lot of hands-on work. So it was all the courses were face-to-face. They did have a LMS component, like an online component through Blackboard, but it was hardly ever used. Even whenever it was used, it was for extremely huge courses like the foundations courses, and where there is like a cartloads of reading to do, and there are multiple segments and 100 instructors or something like that. So, but when COVID hit, all these courses had to be moved online. So they pretty much became fully online courses. And I can't even point out a number, but I think in the last year, so Baylor has 4 colleges. It has Tropical Medicine, Graduate School, School of Medicine, and then it has School of Health Professionals. We work closely with School of Medicine. We converted all their courses online, which was probably about 500. So pretty much I can say a ballpark figure like 1,500 courses. We trained about 600 faculty in distance education and instructional design in a year. I hope that answers your question, Aaron.
No, it does. Thank you very much.
Were those in Blackboard?
Yes, it was in Blackboard, but we also used components of Articulate Rise to, for some of the modules. So we taught them to use a variety of different engaging tools. We gave them a little toolbox that, okay, these are your tools, and, go run with it. So, but now this year, I think next year, they'll probably go back to being like a hybrid component. But now, so much has changed. This whole culture of online learning and online instruction has come into play, that they'll still keep that element, that online element there, but there will also be some face-to-face components. So now students are coming back to classes now, slowly but surely.
Well, I want to ask you about that, whether your job has changed forever or are you still in transition? But before
Forever.
before we get to that specifically, how it's changed forever. So you graduated from Houston in 2017, maybe?
Yes.
And you're sitting around at home on the couch one day and you're saying, well, maybe I should take this job and apply for this one at Baylor. Now, maybe that's not what happened. Tell us what happened. How did you end up at Baylor in this?
I think after my graduation, I first ended up at UH College of Nursing. So I've been with U of H since 2008. So it was like a long-term relationship. So I went from student to employee in a matter of 4 months. Like I graduated and
you've seen Houston grow. They want to be in the top 100, top 75 in the country. So you've seen this growth. I've seen it on the campus too. So you're able to work there, go to school there, and be part of it. It's got to be a vibrant kind of experience, energizing kind of experience. Be part of a place that's not losing enrollments, not that's getting much more endowments. I mean, they're listed the top 100 in endowments sometimes now that they weren't a decade ago or 2 decades ago. And so and now they're getting their own medical school on top of that.
Yes.
So,
It started, I think their first batch started recently. their first class
They
target.
gave their opening talk to the folks there, I
Oh.
think, or the medical folks. They had a conference around it as you were there. So 2 years ago or whenever that was,
Mhm.
almost 2 years ago. So, so were you sitting on the couch when this position? Well, no, you weren't, because you had the job at Houston.
Yeah, I was working
Were
with
you-
College of Nursing. I was their only instructional designer, and I did a whole lot of work there because similar scenario. I think, I came from a culture where instructional design is, so accepted, and everybody's using a lot of tools and a lot of engagement, a lot of creativity when you're teaching courses, especially online. So I came from that world, and
wait a
then
minute, wait a minute.
yeah.
That world being India or being the
No,
US?
no, College of Education,
Okay, okay.
UFH, university.
India,
Yeah.
India is not embracing of ed tech generally.
I have no idea about India. I have not
Yeah,
lived there in over 20 years.
Yeah, they're starting to now. It's
Yeah.
changing, and we're getting people applying from India
Mhm.
for our doctoral
Yeah.
programs.
But
So
College
it's
of
changed.
Education, College of Education is very innovative in their teaching and learning. They have a
At Hu-
big,
at Houston.
lab, and yes, at Houston, yes. But in healthcare education, I saw a little bit of a contrast where it was because I think the nature of courses is such, that most of them are hands-on, most of them are things that are more practice-based, clinical education, and also they don't have understanding of how instructional design can support them because they don't teach online. So that's why I saw that bit of a gap there. So it was very surprising for me because even though they had an online component to their courses, they weren't really using any of the tools that they had, like some tools in Blackboard or tools in Microsoft, or those kind of things. So I did a lot of work in the College of Nursing, first establishing, getting that faculty buy-in, getting, never quitting, just sort of, convincing. I would hate the word convince, but sort of talking to them about what instructional design is, how it can support, how it can improve their courses and their teaching, and how, it will benefit that student experience. So, a lot of trainings that I did, and I guess that the amount of work that I did, I probably did like double the work of what the scope of my job was. And one fine day I was sitting at my couch thinking that I've done all this work and I'm a PhD, maybe I need to do something better and higher. I saw this posting from Baylor. I applied, and I went through a 2 or 3 interview process, and I wasn't sure. I wasn't sure if I did that well because I felt like I'm still a late bloomer. I'm still sort of a, young blood in the field with 25 years experience. But I think they were the right fit. They were looking for a team to build an education innovation core to introduce instructional design and instructional design services in the institution, and to have that dialogue with faculty and leadership. That, I guess, it just sort of happened.
Just sort of happened, but now
Just
you're
sort of
saying
happened.
you're there, and you're there, and it's changed since you've gotten there. Your job has
Yes.
changed.
Yes.
What aspects
Yes.
of your job have changed, and
Um,
what ones are forever changed?
I think forever. What forever changed is that I got reassigned 2 months ago. So I was initially hired with the executive director of the innovation core, and I was a senior instructional designer. So we were hired as a team to establish that core, which we did. We hit the ground running, we established the core, we established a whole process of course design and development and review and training and workshops, so on and so forth. But 2 months ago, I think, everybody saw what instructional design looks like, and they got that experience, and it was like a shiny object for them, like, wow, we want that too, we want that service. So what the leadership felt was that the institution itself was getting a lot of need. They were getting a lot of ask for a lot of projects, like e-learning projects that were specific to institutions, something like, say, going back to office kind of training, or so inclusion kind of training, which is not just specific to a school or faculty and students, but it is specific, it is institutional wide. So basically for our department, to handle that scope was hard. That's why what they did is that they it reassigned me so that I could handle some of that ask, and I could work with another team, and we could sort of, take care of the institutional ask, and the core would just work with the schools more towards curriculum. And this was more institutional. So I think now I've always been in academics, I have a education background. So for me now, I think it's become a little bit, project management based. So I'm still learning my way, getting used to some of that business lingo. But, and I think this puts me in more of a leadership role. It puts me more in the forefront for that particular department. So earlier it was more of a doer. I was working very closely with the executive director, but now I've become more like I wouldn't say decision maker, but collaborator in terms of, making big decisions about, what kind of projects we can handle, what kind of, trainings we can do institutionally.
So what's the next step up? If you were to move up, what would your title be?
I guess manager, management. I think I've always thought about it is like go into that management field, but just haven't had the time to, delve deep into, either pursuing a certificate or going for another degree. But I think mostly that's, when you're in instructional design, that is probably your, your chart as you go from ID. And in your phase, they have numbers. So it's ID 1, 2, 3, and then you go senior. And then I think you become a manager and so on and so forth.
So Aaron's putting in another question. I don't think
Yeah.
you asked that, Aaron. So you want to jump in and ask it? Because I have a follow-up related to that question.
Yeah, he's
No,
asking me. Go ahead, Aaron.
No, I was just curious if you were working with augmented reality. I thought I saw that somewhere on your bio, but maybe I just made that up.
Similar. I worked in simulation, another happy accident when I was at the College of Nursing. Okay, since I was the only instructional designer, and I'm the self-proclaimed nerd. I worked very closely with the IT manager, and he was also working with the clinical facilitator, and they used a lot of mannequins, those mannequin models to conduct a lot of their lab work, before they actually go out in the field. So programming learning experiences for the students, having those conversations with faculty that, okay, if you want to teach this, then maybe this mannequin can, we can program it, or we can have a sort of a scenario for the students where, it's like a cardiac arrest, and how would the nurse sort of treat someone like that. So I worked a lot in that simulation lab and just got interested, in it, and attended a few conferences, got trained in operating those mannequins. I went to Waco for that training. And I wouldn't say this is augmented reality, but it was a different, very different instructional design field compared to what I do. Mine is more curriculum based, but that was more, on a clinical education side of it. So I think it was pretty interesting.
So I saw the simulation thing posted too. And in the nursing field, the use of simulations has changed dramatically over the past couple of decades.
Mm-hmm.
And the fidelity and
yes, high fidelity,
high fidelity, and many are moving to virtual simulation. I think UCLA is one that has. There are many other institutions as well. I saw one. I've got a copy of the simulation itself. Really, really enriched and really intense and of high fidelity, or really engaging.
Yes.
And the scenarios embedded within are life and death kinds of things.
Yes, absolutely. I worked for a grant called the End of Life. That was one of my main projects that I worked with in College of Nursing. And this was with a high fidelity mannequin, and she was programmed to, die over a period of time. And that whole, I think the first case was when nursing students came in. It was in their first semester, when they were introduced to that patient, and how she had cancer, and just her basic vitals is what they used to check. And then over time, at the end of summer was when she would pass away, and there was a whole training that we would program with the mannequin. We had like standardized, some of our staff was the standardized sort of character, maybe playing the husband or the son, and we would create this entire, scenario where they had to interact and have those really difficult conversations that, your mother is going to pass away. So how would you as a nurse sort of conduct those conversations? So it was a really interesting project.
Have you seen the ones where you wear the headsets?
Yes,
and
the
you-
VR. Yeah. I think we did something like that. I think it was I don't know if it was schizophrenia or something related to mental health was when we had used those VR sets, where they would have some sounds and then, experience some kind of stress, and then that was evaluated. I don't remember anymore. It
I
was
think
a while
Stanford
ago.
has them where you wear them and you, as a doctor, can feel what it's like to be a 74-year-old patient and have all sorts of ailments. So
Yes.
and they also have them so you can understand what it's like to be homeless, taking the
Mhm.
subway, and this or that. But the simulations within VR become again
Mhm.
really powerful for empathy, for social
Yes.
cognition kinds of
Mhm.
things. So
Absolutely.
going back through your dossier, there are many projects that you have in there. You want to pick a couple out and describe them, and you can even show them if you want to. You can drive a little bit here, because you can share your screen if you want. I didn't tell you were going
Okay.
to do that, but if you want to pull a couple of those up, and then I'm sure people would benefit from seeing you talk about them, and what you did in terms of your job as the designer. What were the kinds of skills that went into that project?
Oh gosh, this one is a tough one. I think, okay, let me share my screen. Let me pull up.
I think you can share. I don't need to make you a co-host, but I can if I need to.
No, I think I can.
There you go.
Yeah. I think for me, I know I did a lot of different projects. I mean, this is that simulation handbook. I haven't linked things here because of copyright, but I had created this in Articulate. It was like a, hotspot kind of a thing. And we had taken pictures of every aspect of the simulation lab, and whichever thumbnail you click, it would open up, information about that aspect of the lab. But I think my most favorite one was the belt training series. So I feel very strongly about faculty development. I think I'm a teacher at heart. I love teaching. I love, seeing that, aha moment when I teach people something, or when I teach faculty something and then they use it and they're like, oh, wow, this really worked. And, I mean, my students are so happy and my evaluations are skyrocketing. So those kind of
I
things.
definitely understand that, because my dean wrote me today, and we're working on creating a library, a remodeled library. And I said, well, that's when you see it, when you see the actual library being built, just like when you see your courses, you actually see people using the content or citing or whatever. When you can actually feel it in action, you get a lot of energy from that.
Yeah.
And you see the impact, in effect, the impact of your work.
Yeah, so I think, the belt series, and, this was, I would say, the College of Nursing, I consider it my first job, even though I have worked variety of different jobs. But I think it was my first job as an independent instructional design, where it was all my ideas. It came at a time, when I got a lot of pushback from faculty in terms of, learning about new tools. And they always ask, like, why do I need this? Why do I need to learn something new? I just, this is how I teach, and this is my PowerPoint, and that's how students learn. So really educating them about the benefits of instructional design, and what are some of the tools that are available to them. First, they did not even have awareness that, okay, there are some tools that are there that I can use in my, everyday classroom, whether it's online or face to face. You can have polls, you can have a variety of different games, those kind of things. So this whole series, came at a time, when it was really, I saw that need, and I talked to when I had Anita analysis at the institution. And what I believe is that, you can't just, it's not about the technology, it's at the end of the day, it's about good teaching. Technology is basically, it's a supporting tool, it will sort of add to that experience. So I created this a series, Belt, bites of e-learning tools is what it was called, with the tagline, you have some cool tools under your belt. Yeah, that was the tagline. And the whole process was really interesting. I even presented a whole paper on on the process in eLearn 2 years ago is, I really created sort of a buy-in, and I marketed the whole series, and, with these taglines, created flyers, emailed those flyers to everybody, posted them across the whole college, and, getting that hyping it up, that, okay, this is a series that's coming in, and you have all these cool tools, and everything was thematic. If we would have like a presentation month where it would just be tools on presentation, or how can you, create a really cool PowerPoint, how can you use multimedia in a PowerPoint, those kind of things, how can you make things dynamic. So it was also rooted a lot in, like how adults learn, focusing that, focusing on providing information on why learning the technology is important, sort of tapping into that internal motivation of faculty, and then communicating that why it's relevant and how it can, it can benefit you. So it sort of compromised a lot of different topics like reflection, engagement, curation. So, and each of basically, it was just a 30-minute session, just 30 minutes. And why 30 minutes? I sort of marketed as micro learning, although micro learning is way shorter. But if you look at nursing faculty or any healthcare education faculty, they're very busy because they have research, they have scholarship, they have their students, they have their clinicals, they have their jobs, they have a lot going on. So they really don't have so much time to, devote to training or coming to a particular classroom and spending that time. That's why this was completely web-based, 20 to 30 minutes, no more than that. It started with introductions, and I always used Garnier's, theory, where there would be like some kind of an beginning, where it would be something to grab their attention, maybe like a little game, like a little poll, and then going into, what are some of the theoretical perspectives related to that tool or strategy, and then a demo, and then they would have some interactive experience with the tool. Like with Kahoot, they would play a game. With Padlet, they would have some kind of a back-end conversation on it, and then they would have questions. So it was a really interesting series, and over time, I did that for 3 or 4 months, but the attendance was really low. So I was like, oh, something is not working, they're not attending. So I came up with a digital credential system for them, and, started giving out badges that you attend 3 sessions, you get a particular badge. You attend 6, you get a badge. That badging sort of got everybody going because it suddenly became competitive. It's like, oh, she got a badge, I want a badge, and then those achievements were posted on social media. It became part of their evaluation. And then, once that whole badging system started off, I took it one step further, is where, I created a whole pathway for them that, okay, if you have these amount of badges, you've attended so many sessions, next you would start applying this tool, show me evidence, how did you use Padlet in your teaching? And then, once that happened, I started another session called Tech Fluent Talks, where faculty would teach faculties. I think because my goal always at the end of the day is like empowering them to, do their own teaching, to help themselves and help each other. We are just sort of vehicles that will sort of take them to a certain place, but they have to go inside the building on their own.
What was it called?
Tech Fluent Talks.
Tech Fluent Talks, okay.
Tech Fluent Talks. So I had one faculty who had used Padlet in variety of ways with her first year, undergraduate class. And she demonstrated the tool, and that was a face-to-face session. It was not online. The nature of that talk was the whole sort of vision behind that was make it like a collaborative, like a small group. The tool, she showed what all she did with the students, and then everybody had as a takeaway, as a deliverable, everybody had to convert one of their lessons or one of their activities using Padlet. So that was their takeaway.
Yeah, I'm using Padlet this semester too with my Saturday class, and I'm using Jamboard, and now Miro. Miro is a very powerful tool. Have you seen that?
I think so, yeah.
Yeah. So can you show us quickly, because we're running low on time, can you show us another project maybe that you've been also in your dossier?
I think, let me go to Rise. I think one of my favorite ones is this whole course that we did called Team Launch. and it's still not live. So, but I will still show it to you. So this is an institutional wide training.
This is new?
Yeah. Yes, it's an institutional wide training. Initially, this whole project was developed in articulate storyline with scenarios and with characters. So some of that part is still incorporated in it, but most of it is in RISE. And this was an year-long project. So this involved initial kickoff meetings, storyboarding the whole thing. There were like multiple reviews of storyboarding. So that's one more skill. If you get a chance, develop it. It's not very hard. You just have to keep in mind, with those different elements and what are some of the visual elements that you'll incorporate and how you'll connect it with the content. But it was a very, very lengthy project. But at the end of the day, it turned out really good. We used RISE for it to make it easier for our faculty. She was the pioneer, Dr. Coleman. She's the pioneer of this project. And, the initial one required a lot of audio recordings. And, with the time factor not working out, we decided that let's make it asynchronous. So, you have to sort of be flexible when it comes to, instructional design projects, because you have to see, what the need is and how the scope of the project is, especially when it's someone.
Wait a minute. Was your faculty training synchronous or asynchronous?
This was synchronous, 30-minute synchronous sessions. And then they were all recorded, and everything came with a guide. So if I'm teaching them about Padlet, there would be a guide that I would create for them, on how to use Padlet, like a PDF step-by-step with screenshots. So a follow-up would be with all resources and examples and all.
Sure. But what about the faculty training the faculty? Was that synchronous or asynchronous?
That was face-to-face.
That was
face-to-face. Yeah, that was like in real time.
I was wondering because okay. So
yeah, that was the only thing face-to-face, because we wanted it to be like a community of practice where they're actually working together. We had sketch markers, we had big papers, and they would like brainstorm ideas. So we needed it to be like that.
Right. I agree. Is there anything else you wanted to show on that last project, the new project?
I think, I can link some of these things over there. It's very simple. It is basically RISE is a very intuitive tool. And what we had is that every segment had sort of an evaluation. So we developed a character, we created a whole scenario with dialogues and all of that. And, we made it so that, once the user is working through this, they can't move forward till they, actually go through this whole process. So it pretty much continues on the same note, and, and that's how you keep going forward. But it was a very lengthy project, because as you see, there is so many modules in it. It has 3 modules, and each of these are like, the storyboard were like about 50-60 pages long. So, but a lot of design element went into this, a lot of visualization went into it, thinking of, images, at the same time thinking of inclusion. So, adding, having people of color, having, those accessibility factors where you all tag all the images. So a lot of moving parts, that came into play.
Very cool. You've done a lot of interesting work, I must say. You're not only a senior instructional designer, you're a premium senior instructional designer.
I still call myself jack of all trades, master of none. But that is the case with all instructional designers. Believe me, you'll learn on the job. You'll learn so many different skills, projects that will come your way where you'll have to teach yourself something new. That it's always going to be a very vibrant, dynamic experience. You'll never get bored.
I'm sure that. I got 3 questions left that are short questions. I want to make sure the audience doesn't have I want to make sure they ask their questions. So Melissa, you haven't posed any questions for Anita. Would you like to jump in here?
Yeah, I don't have any questions. I really appreciate you sharing some of your ideas, because my main job at the seminary that I work at is helping faculty and helping them with their courses. A lot of them, as you may or may not know, theological graduate work is traditionally in person, because people preach in person, people teach in person in churches and that kind of thing. And so the whole pandemic, going online, the transition, they had to use the tools that they've had for a while that were never being used. And I only started a year ago in this position, but I actually have implemented some of the kind of concepts you've talked about with learning from each other. I implemented in faculty meetings where I would have a set time to where 1 or 2 faculty members that I had met with prior would share their successes in the online environment. And others would be like, oh my goodness, that's a great idea. You know, there was great, and even though it was on Zoom, but there was just great back and forth in the room. And so for this year, we're starting out with some interdisciplinary faculty groups where they're going, I'm hoping for like 3-person team, so it's not taxing on their time, but they would observe whether it's an in-person, a hybrid, or an online class of their 2 peers. They would get to see how they've set their course up in our LMS. They would get to meet, and then they would share with the group in the next term, either at the end of this term or spring term. They would share what they've learned, things that they want to implement, things that help them grow, and that kind of thing. And it's really open-ended. And so I'm getting some ideas from you because I have had difficulty with training with very low, like I planned this great thing. I'm so excited. I go to faculty meetings, I hype it up. I pass out cards with QR codes, you know, things that, and like 5 people come.
That's good. 5 is good. Believe me. So I've done all of that too. I always have an evaluation at the end because their feedback matters, you know, so that we know, you know, QR codes, you name it. But you know what I believe is there have been so many trainings that I've done is where I've had 1 person or 2 people. I feel that is 2 people more with that knowledge, you know, so that once they have that knowledge, they're going to talk about it, and then that's how it will spread. So 5 is great. Don't be disheartened.
Well, thank you. I appreciate it. I got some ideas from you, so I really appreciate it. Thank you.
Thank you.
And I think we have one other person that hasn't asked any questions yet, and I think that is Kevin. Kevin, would you like to jump in here?
Sure. I don't actually have any questions. I'm just soaking it all in. I've really been enjoying the points you've been bringing up, and they've resonated quite strongly with me. I'm in publishing actually, so I'm probably quite different than most folks going through these programs. I oversee continuing education, so I don't do a lot of instructional design per se. My bigger issue is kind of on that quality side that you spoke of earlier. So I'm trying to make sure that what is going out or what is being absorbed by the people that I have to watch over is of a decent quality. So I really enjoyed that piece of QM. We haven't done anything with that, but I'm certainly planning to look into it, see what's going on.
Yes, the QM also has it's not necessary that you sign up with them or you pay something to get trained. You can use it as a guideline. You know, when I started off with QM, that's what I did. I looked at the rubric. I looked at, you know, what are some of the guidelines, what are some of the standards, and I try to apply that to course design. Same thing, you know, with quality, with professional, you know, those kind of competency courses, you know, those kind of, you know, no credit courses or no credit professional programs. They have rubrics for that too. So that's, you know, it can be like a guideline for you if you look at that, you know.
Thank you.
Yeah, thanks. I've got a few things that are quick hitter questions. You have tilt in your resume. What's a tilt?
So Tilt is BELT 2.0.
Oh, okay.
No, I'm just kidding. No, I'm just kidding. So Tilt is the series that I did in Baylor. You know, that was, you know, those were 1-hour training sessions. They were all pedagogy based as always, but they were thematic as well. So I think it's, I don't do those anymore, but Tilt is teaching with innovative learning technologies. Similar concept, you know, basically using tools to say engage students or design things. The way they were laid out though, during the semester was all the courses were sort of scheduled beforehand. Registrations and all of that was taken care of beforehand, and then just a week before, people would get that Zoom link to attend. It was a synchronous 1-hour session, talked about the theories, the pedagogy of a certain tool. Say if I'm talking about engaging learners through Zoom, or using Zoom tools like whiteboards and polls and all. So talking first about engagement. What is student engagement? What are some of the theories that support student engagement? So that's how it was. Because it was a 1-hour session, you could do a lot. And then of course, each session had an interactive element. So if you're talking about Zoom engagement, they would be given a task. I would put them into breakout rooms. They would have something to discuss, come back, use the whiteboard to display their ideas, so on and so forth. So Tilt was like, it was a better version of BELT, I think, because it was a lot more organized. It was a lot more thought through. It was, more, I guess, at an institutional, a larger, large scale. It was large scale. But yeah.
Sounds like this needs to be written up somehow.
I know. Yeah. I need a co-writer or somebody I can dictate to.
Maybe, maybe somebody who is doing another such things at another university, and you can combine forces.
Yeah.
And create a more powerful guidebook for others to replicate that. When you said tool belt, I'm thinking of so the current AEC director. So the last director, I don't know what happened to him, but he's been replaced by Ellen Wagner. And Ellen's a good old friend. And in 2005, we were at a conference celebrating like the 20th year anniversary of the Distance Teaching and Learning Conference at Wisconsin, Madison. And she wore a tool belt. And she had her mobile phone for Japan, her mobile phone for in the States, and all these things on the tool belt. So yeah, it was a good metaphor. It really resonated.
Yes,
She actually wore it for her keynote talk or whatever. And then there's a funny story that follows, because after that I had my lightsaber with my R2D2 models. So we had a lot of props on stage, let's say. It was recorded, it was a lot of fun. 3 other questions. You mentioned stakeholders. You have to, you're sometimes concerned about whether you've built the proper tools or designed the proper project for stakeholders. Is there a particular stakeholder that you dread speaking to, or you get nervous speaking to? I'm just curious. Is there
not anymore, actually. I think initially for me, I used to always dread, with faculty that would, like push back, especially in terms of.
You don't want the tomatoes thrown.
Yeah,
Okay,
I mean,
when
and basically it became
we don't
like,
do this in law school,
like,
we don't.
Why do I need to do this?
Yeah.
What's in it for me? Those. Yeah, those tomatoes. I think initially I used to.
In biology, they're all face-to-face students. They're undergraduate 20-year. We're not going to teach online students. Oh, COVID happened. They all are.
Yeah. So I think just getting that pushback, that initial pushback, is what I always used to dread. Not anymore. I think I've dealt with so many of them in the past couple of years that now it's like, I'm like, you can push me back. I'm not going to quit. I'm still going to be in your face, so to say. So, but, I mean, this is what I do. This is my job. This is what has been asked of me, and this is the ask for you. So let's meet at a, common ground and discuss, how I can help you and how you can help me. So now I think I've become a lot more assertive and much more clearer in how to, present my work and, what kind of service I'm, able to offer. But yeah, initially it was quite
can be
overwhelming.
tense initially.
Yes.
When you first get there, and I've done talks all over the world, and you'll have a couple that were forced to attend and don't want to be there. And I had literal tomatoes thrown, but it's changed.
It's changed a lot.
Resistance is futile, as I would. I had my Borg mask on. 2 other things. The last couple of weeks we've been in learning theories. We've been reading a lot of learning theories. Do you rely on any particular learning theory or theories or an eclectic approach? Is there anything that guides your instructional design that people might want to pay more attention to as we're reading different perspectives on learning?
I think yes, actually. For me, when it comes to faculty development or designing trainings, I heavily rely on Garnier's, that 9 events of instruction, Yes, because I think that is such a great framework, especially when it comes to training, when you want to design some kind of training, it gives you a great overview on how you can present, say a 1-hour training, how can you present? That's why I said earlier as well that, my training always begins with some kind of gaining attention. That's why Tilt is 2.0, Belt 2.0, because it always began with some activity. It could be like a fun icebreaker. It could be something related to the topic, or, something that would be sort of a segue into the topic, whether it's watching a video or playing a certain game or answering a poll. So that's how it always began. So Garnier is my go-to, whenever I design training. I think in terms of my instructional design, a lot of them, those common ones like ADDIE and Kirkpatrick, Bloom's taxonomy, constructivism, communicative inquiry, so many of those theories, influence. I would not say there's only one, but you can sort of get inspiration from all of them and, frame your process around that, I think at the end of the day, I think it's all about, the outcomes and, what, whether it's a faculty, whether it's students, whether that learning is successful or not at the end of the day. So,
you got me worried now, because we're going to take a break. I'm going to lecture. These people don't realize that maybe one or two of them do. And you haven't mentioned the person I'm lecturing on, the two people. I'm going to talk about Vygotsky and Bruner after break in social cultural theory.
Yes.
And
that has been my approach always. That's why, I always believe that, you're learning from each other, building that community, because that's how we learn best, from each other, from prior, bringing that prior experience and, bringing in that new knowledge and sort of clubbing the two. So I think that is very key in any kind of instructional design process, because at the end of the day, there is a little hand holding that comes, especially when you're working with faculty, but eventually you want them to be independent and be able to, do
just like your grad students and your master's students. Self-directed learning, a little less hand-holding, as least amount as possible. I think Papert said, right, he believed in constructionism and constructivism. He believed in the least amount of instruction possible.
Yes.
But as we've read, and as we heard from Richard Mayer, who came in a couple of weeks ago, the instructor is extremely important, and the scaffolds put in place are extremely important. It's guided discovery learning that's the most powerful, not pure discovery learning. And I agree with Mayer as well. I agree with in some ways, everyone. Unfortunately, Bruner passed away a couple of years ago at age 100 or 101, and Bandura passed away a month and a half ago.
Yes, I know. I saw. Oh gosh.
And he was on our trustees. He was on our board of directors. So I met him. I've had dinner with him. He signed a book for me, and I've introduced him when he's presented to classes. So, that one hurts a little more. I also talked to, as I told my students, I talked to B.F. Skinner before he died, because I worked with his daughter at West Virginia. So I've met some of these old timers. There aren't many left. Richard Mayer is one of the people I think is a key person who's still working very, very hard. My final question then, it relates to that, is, you've done a lot of things. And so a two-part, what's left in your to-do list, or what you would like to do, and what kinds of things you see happen? What trends are enticing for you on the near future? What's coming? So what would you like to do, and what's coming? Help us out.
I never have a to-do list. I'll be honest. I feel that, this field
bucket list
is
for Anita. No
bucket list. I think, over time, especially with COVID and, designing courses and, facilitating or, helping faculty facilitate synchronous sessions, and seeing how all of that turns out. I think my interest is more towards now accessibility I think that is the next step, because now, they have the understanding of how instructional design is important. What are some of the theories that inform it, what is good teaching, what is effective learning. But now, how do you make it accessible? That is the next step, especially for my institution, where that knowledge is still a little bit lacking, and we do need to have some serious conversations about, some of those things, that courses should be readable by the screen and those kind of things. Also inclusion. I think a lot of times what we experienced in the past year is, students did not like to have their video camera on, or they did not like those synchronous sessions, because it sort of gave us a sort of a showcased their background, like they're tending to an old one. There's a child playing in the background. It sort of gave it sort of gave an insight into their socioeconomic, into their, sociocultural status, which sometimes some students are not comfortable sharing. So it sort of brought that whole conversation of equity onto the table.
Right.
And I think, so I think, those kind of things are, I'm still learning. I'm not an expert, but I'm still reading about those things. And, I think that is next on the bucket list for me.
Sounds interesting and exciting. I know we'll keep in touch because I've been teaching this class 3 semesters in a row, or next semester will be the 3rd. I had a sabbatical somewhere in there. And I think I've rode through my Rolodex of inviting guests. And I think this session has been so good of all the sessions I've had. I don't invite people back, but I want to invite you back next semester for students in the spring. Because I think they could benefit a lot. Give her all the people, Melissa, Aaron, Kevin, give her the thumbs up. So if you agree with me on that. So, anyone want to jump in here and add to my comments here, or any final thoughts from anyone? Or a final question? Or if you can put it in the chat window, you can put 3 words for this session, what you got out of this session. You can jump in and post something for Anita. I think this has been wonderful today. I'm very appreciative of you coming in, especially since we have so many people in a row that are at the outer edge of their career. And so we need to hear someone who's in the midst of a career and digging in as I said, in the trenches, developing new programs, adjusting to life in COVID and post-COVID times. So I am going to get you back, and I'm going to stop the recording.
Thank you so much for having me. It was my pleasure, and I was nervous and excited at the same time. But this was great. Thank you so much.
So I'm going to stop it now with those words. You had the final words for today. So thanks, Anita.